Assalamu alaikum, Bismillah ar-Rahman ar-Rahim. I am Dr. Ali Tidal, an Iraqi internal medicine resident from Basra city. In this video, I'm gonna describe and explain a topic of one of the most important topics in infectious diseases and sexually transmitted illnesses. This is the first video I will make, and if everything went well, I'm gonna make multiple videos on different topics, mainly in my scope of interest, which is internal medicine and its subjects. So in this first video, as I've mentioned, the topics is the genital ulcers. Genital ulcers has a different etiology and causes. It might be a diseases, syndromes, and even idiopathic ulcers. We will concentrate on the 6 most common, let's say, causes of these ulcers. So the genital ulcers, it might causes due to the syphilis or genital herpes, chancroid, lymphogranuloma venereum, granuloma inguinale, and even Passett disease. Okay, this one. So let's start with the syphilis. Syphilis caused by the microorganism called Treponema pallidum, which is a spirochetes microorganism, while the genital herpes, as the name explains, it caused by herpes simplex virus. Serotype 2, because serotype 1 we will have the oral and buccal ulcers or vesicles, while in herpes simplex type 2 it causes the genital herpes. Chancroid, it's caused by a bacteria called Haemophilus dorseri, and lymphogranuloma venereum caused by Chlamydia trachomatis. And if you remember this bacteria, Chlamydia trachomatis, it may cause the UTI itself. So in lymphogranuloma venereum, we have 3 different serotypes: L1, L2, L3. This will cause the lymphogranuloma venereum, while the UTI caused by the D and K serotypes of Chlamydia trachomatis. Okay. Then the granuloma inguinale, it's caused by a bacteria called the Klebsiella granulomatus. Okay. And lastly, the Passett disease, which is an autoimmune inflammatory disease of not well known or understood pathophysiological mechanism, but it's an autoimmune inflammatory disease. Now, syphilis. The clinical feature of syphilis, for each and every single disease of those, has a characteristic distinguishable feature that you can tell whether this syphilis, this genital herpes, chancroid, and so on. So in syphilis, the ulcer characteristically painless ulcer of no pain, and usually the physician or the patient itself discover it by chance or by incidence, usually by the patient or its partner. Now, the shape of the ulcer is heaped up ulcers, heaped up border of a clean base. The base is clean, and usually single ulcer. In genital herpes, as we've mentioned, the cause is herpes simplex virus type 2, and on the opposition to the syphilis, it is painful ulcers. So in syphilis, it is painless, while in genital herpes it is painful ulcers. It is multiple, not single, and of a vesicle. You may find a vesicle, which is a fluid-filled vesicles on the genitalia, and of a erythematous space, as we know. لأنه erythematous space also on the buccal trunk you may find it. In genital, the same thing. It is erythematous space and multiple painful ulcers. Now the chancroid. The chancroid, as I have said, it caused by the Haemophilus dorsari, and think like that. Chunk like junk. Okay? Like junk. So it is a junk. That's to say, it causes a purulent, deep, painful ulcers. So chancroid caused by Haemophilus dorsari, purulent, deep, painful ulcers. In addition, the patient will have suppurative. It is a junky bacteria, so it is suppurative inguinal lymphadenitis, which is the inflammation of the inguinal lymph nodes. In lymphogranuloma venereum, the causative microorganism Chlamydia trachomatis, serotype L1, L2, L3, and it has 3 different stages. In stage 1, we will get the ulcers itself. In second stage, we will have the lymphadenopathy, and in the third stage, we will have and let's speak. Okay, the proctocolitis. Sorry. So in the first stage, we will have the ulcer. The second stage, we will have the lymph nodes, and in the third stage, we will have the proctocolitis. Okay. Granuloma inguinale caused by Klebsiella granulomatous. Again, it is painless ulcers and no lymphadenopathy. So it's only painless ulcer with no adenopathy. So you might ask, how can I differentiate between the painless ulcer of granuloma inguinale and the ulcer of the Treponema pallidum? That's why we have investigation. We will investigate. But when you have or face a question that tell you the ulcer is painless, you have 2 main causes. It either syphilis or granuloma inguinale. The question usually will put one of them, either syphilis or granuloma inguinale, which is painless ulcers. While the genital herpes, the chancroid, and the lymphogranuloma usually painful. Now, after we know the clinical feature of each one, let's describe some of the syphilis information about the syphilis. Syphilis, it has 3 main stages: the primary stage, the secondary stage, and the tertiary stage. In the primary stage, we will have the genital ulcer, which is the scope of this video. The genital ulcer, it is the primary syphilis in the primary stage. In the secondary stage of the syphilis, we will have the inflammatory systematic signs such fever, generalized trunk rash, and buccal ulceration and condylomata lata. While in the tertiary stage of the syphilis, we will have ascending aortitis or ascending aorta aneurysm, tabes dorsalis, and arginine Robertson pupil. الأرجينال Robertson pupil, it is the pupil that not react to the light. Normally, the light, when you put a light on the pupil, the pupil will constrict, while in the arginal Robertson pupil, the pupil does not constrict to the light. So it is arginal pupil. Now, we are here concentrate on the the primary syphilis, which is the stage or the primary stage of the syphilis that causes the painless ulcers. Now, for the investigation or the diagnosis, sorry, the syphilis, we can clinically ask the patient about his sexual travel history. Then the examination of the ulcer, we will see heaped up border of a clean base, usually single, and he will say it is a painless. Then we have the laboratory. We will start by the screen with VDRL test, which is the venereal disease, I think rapid laboratory, okay, and the RPR. This is the screen test. If the screen were positive, which is high sensitive, but it's lack the specificity, then we will continue to another specific test, which is either dark field microscopy, or the FTA ABS tests. Either one of them, we will do it, okay, to confirm the syphilis. So the screen of syphilis is with VDRL PRP, and if that's were positive, then we can confirm the syphilis by either one of the either direct field microscopy or FETA ABS. Okay. Genital herpes. The genital also the same thing. The feature that you have, and mostly PCR will confirm the diagnosis, or what's called the Zank smear. You can Google it, okay, but mainly by PCR, okay. Now for chancroid, the diagnosis, it is a bacteria, so we will start with the gram stain of gram negative. It is a gram negative indeed bacteria, okay. And also we have culture. We may culture the bacteria, and finally the PCR also. In lymphogranuloma venereum, it is also a bacteria that can be culture, gram stain, and PCR the same thing. And in granuloma inguinale, Klebsiella also a bacteria, so gram stain also, and it is also gram negative bacteria, okay. And in addition to that, we can do biopsy for histological examination. For the treatment, the syphilis historically will respond to the penicillin, very responsively penicillin, so penicillin. In genital herpes, oral acyclovir, and in chancroid, either